Good morning, everybody. Dr. John Willardsen here in beautiful Newport Beach, California. Trust Implants, trustimplants.com. I'm here with Memo Hea. Memo, how you doing this week?
I'm doing good, doctor. It's getting cooler here in Newport Beach.
Yeah,
you know,
it's starting to cool off a little bit.
Yeah, it's time to pull out the winter coats and all that to be able to warm up. But other than that, it was a good week. As you know, we stayed busy here. There's a few things that we are just kind of looking into implement ourselves here for the office. And
definitely.
Then also for me, as you know, all my personal stuff, wake up in the mornings and trade Forex.
How's that going? How's the Forex going? Any news out there in the world?
Yeah, so yesterday there were CPI numbers, which means pretty much where like the economy is going, and it's looking good. It doesn't look like they're gonna raise any interest rates anytime soon, but probably in a year they're lowering them. The U.S. dollar took a kind of a hit, but yeah, I don't want to dive too much into it, but just that's kind of all the things that I look into. And I also was looking into I'm 29. I'm turning 30 next year, and I've been doing a lot of research about, when you hit the age of 30 to just go do your blood work to stay on top of your health. And so it's probably
you need to check, all your levels, testosterone, and make sure that you're in good shape that way. What do you do to keep yourself in shape? Like what's your routine right now for that?
So I run a lot. I do a lot of boxing, but like I said, I don't think my body can take the damage as much anymore. So I started doing.
Toll.
I know it really is. It really is, doctor. Yeah. So I actually started doing jiu-jitsu a couple of weeks ago. It's good. I like it a lot. Yeah, it's a great workout.
Intense, right?
It's intense, but you don't take as much damage as boxing. Like when you spar, I don't know. I feel like let's say I'll spar in the morning, and then the rest of the day I have a headache, my neck hurts. And
after boxing.
Yeah, and
taking a couple headshots.
So yeah, those things, we kind of have to stay healthy always. Yeah. It's good for the brain. It's good for the body.
Yeah, for sure. And ignorance is bliss, right? If you don't know then you don't know, and then you just kind of go along. So it's important to recognize, know your body, recognize if there is a problem, deal with it, take care of it, especially as we look at like blood sugar, A1C, because diabetes, our diet is so wrought with sugars and carbs, right? And so, it's kind of amazing that everybody's not diabetic. I think most people are pre-diabetic just because of and we've become more conscious, I believe, in our diet. Growing up, it was all cereal and sugar and soft drinks, and it takes its toll on the body. So, well, that's good. That's good. Get that blood work done. Keep working out. For me, I try to do a little bit of the gym, cycle, rowing. I love the rowing machine.
What gym do you like to go to?
I just go to the gym that's in our neighborhood. It's a smaller gym, but they have, they've got everything that I need. I'm not trying to, I'm just trying to stay in somewhat decent shape. Yeah. One, because, I have to do something because, the intensity of the work that I do is, I've got to keep my head clear and keep my body strong so that I can keep pushing and doing these cases,
Oh, for sure.
Anyway, so yeah, thanks everybody for whoever's watching us this morning. And we started a little bit on time, so that's good. We're going to go through a case here, a couple of cases actually. This is a patient who, and I think his before and afters are on my website, but what I'd like to do is kind of go through the entire process from A to Z and talk about some of the nuances and the details and intricacies of doing this type of work. So you can see here his before photo, of course, and he's got some teeth on the bottom which need to be removed. And so let's take a look at, and we'll kind of look at, we'll watch this video. It's real quick. I'll kind of speed through it. But this is on the day of his surgery. And so this case, I'm in surgery here for probably 8 hours on this case, even though we speed it up into a 10-minute video. But so of course we're just giving him local anesthetic here. We're starting on the upper, and well, we're giving him local. I'm actually extracting the teeth first on the lower, and very gently rotating, putting what we call axial pressure down the long axis of the root. Make sure that the tooth rotates out smoothly. We don't have any root tips that fractured off into the jaw. And then I start to elevate the flap or the gum tissue from the bone. And a lot of times the root tips are fractured off, or the teeth have decayed down into the bone. And so I have to kind of make my way down there so that I can visually see what's going on, and also be able to get the teeth out without any, leaving any fragments or remnants of the tooth in the bone. And then here I'm just doing what's called an alveoloplasty. So I was just smoothing the ridge, contouring the ridge, making sure that it's nice and even. Again, the body likes, it does not like it likes even surfaces. If I didn't smooth the ridge off and I have one implant here and another one up here, the body's going to level that off, and I'll lose bone around the implant that's taller or that's up higher. So we don't want that. So I need to smooth everything off so that the ridge is intact and contoured well, right? And here I'm just starting my pilot hole. So I'm locating the position of each implant. Once I know my position, we take x-rays and we do whatever we need to do. And then I start to open the aperture of the osteotomy or the hole. And, I've said this in the past, but each osteotomy is very different, even in this case here. So a couple of them are in extraction sites. Some of them are in healed bones, healed sites that's just in bone. And so I have to treat each one very differently. I need to know how to navigate. And as I put my drill in the osteotomy or the hole, I have to have a good purchase point or fixation point, so that as the drill drives down into the hole or the osteotomy, it's not bouncing around or moving around. I have to make sure that I have a good fixation point as I start my drilling. And if I continue, and as the surgeon, I know each osteotomy, I know each hole. So I know the position of my wrist, I know the position, and I can feel if it starts to fall out. If I'm in an extraction site, I need to correct that. So these are just the technical details and the nuances of doing cases like this and ending up with a result that is going to last the patient, for the rest of their life. And so you just saw that I placed the one implant in the back. So here I put bone in the extraction site so that I fill any voids, put the implant in, and then I'll fill all of the holes after we go to close. And you can see I'm just kind of filling. And the implant is not exposed at all. I'm just kind of contouring the ridge and making sure that I have a nice, smooth, even surface throughout the entire ridge. And then we're just driving the implants into the osteotomies. So there's a lot of detail that goes into these cases that, and that is important. It's super important to maintain consistency for me on every single case. Like I even though I have to deviate and vary a little bit on some of the cases, I try to maintain the same composure and consistency on every single case. So, what that does is it gives the predictability back to me, so I know that I can predictably do it and have a good result in the end. So, and here we're kind of finishing up on the surgical aspect of it. I put a membrane over the top, make a small incision in the membrane, and now you can see I have the healing caps that are all now exposed. So I'm getting ready to suture and close the site up. All the implants are in place. So when I put the implant into the hole or into the osteotomy, you saw the torque wrench, right? And on that torque wrench, it tells me how much torque I have on each implant. So I'm able to determine how soon I can load the case. And so it's just requires a lot of detail. And again, we've kind of fast forwarded a lot of this stuff, but I was in surgery on this case for probably 7 or 8 hours. I don't even remember, but and that's why we need to keep our minds healthy and clear so that we can continue to do this day in and day out.
Yeah, I could imagine, doctor. This is, you're doing this. You're saying 8 hours, and you're really having to stay focused and your hands still because it's a surgery. Things could go wrong.
Yeah, it gets pretty intense. To go in and do this day in and day out. It's great. I love it. I love what I do. But it does require that, that I take care of myself. Like you were saying, Memo, that make sure I stay, strong and healthy and make sure that my blood work is good. And but yeah, it can be pretty intense, as we go from one surgery to the next. I have to kind of clear my head and make sure that everything's good. So, and again, here I'm working on the upper jaw, locating the position of each implant, and just making sure that we take X-rays on that initial osteotomy step, and then just open the aperture of the sites, the implant sites, as I go along here. So I'll kind of fast forward through some of this here. And
doctor, there's after we or whenever you present this case, because one of the things that we have mentioned to our viewers is that we want to kind of talk about all dental implants, but just the industry in general.
Mm-hmm.
I found a site here, the American Academy of Implant Dentistry.
Yeah.
You've heard of them?
AID, yeah. Mm-hmm.
So they come out with news in the industry of what's going on. So
right.
Hey, we can do is we can kind of cover those things because they talk about practices joining DSOs, things that we've talked about before,
Right.
So, but I'll let you,
Yeah, that's a big topic right now. A lot of the venture capital money are kind of taking over the private practice, and it can be a good thing. If the doctor who's at the end of the day, it's all about the patient, right? It's all about making sure that the patient gets the best care possible given their situation. And it's not dictated by the financial interests of the company who bought the practice, and so if they start switching implant brands or the type of bone that that needs to be used because they're trying to save on the cost of the case, that's when it gets a little. For me, I would rather be able to have control over that, so and not be dictated by somebody telling me what system I need to use or how I need to do the cases, because at the end of the day, it ultimately falls on my shoulders. So, anyway, so let's talk about this patient here. So we saw some of the surgical aspect of his case. So that was the placement of the implants, extracting the teeth, placing implants, grafting, sinus lift, and here's his pre-op photo. And so what happens is we take the CAT scan, and here's the X-ray that when we, the pre-operative X-ray, so before we started the surgery. And then, so you notice he's got some natural teeth here that need to be removed. There's an infection down at the tip of the root here. And so all of these things I have to be aware of. And then on the side of the anatomical landmark, so where is the nerves I need to watch out for? Where's the sinus? all of these things I need to know just so that while I'm in there, I have an idea of the relationship between the tip of the apex of the implant and the inferior alveolar nerve, for example, this red dot here. So I need to know, like, how far away am I from the nerve? So, and here I've got a lot of room. Sometimes it gets really close. I can get up to about millimeter, 2 millimeters from the nerve. But if I know where it's at, I'm not gonna touch it, because I'm aware of where it is. So this is kind of the pre-operative planning part of it. And so I want to take a look at, how did my pre-operative planning compare to the actual outcome? And so, here we'll take a look at some just kind of the real quick video of the model of his mouth before. And so we're just kind of looking at the structure of the maxilla, the upper jaw, the mandible, the lower jaw, this, where the mental foramen is, the nerve that innervates the lower lip, and just identifying some anatomical landmarks so that when I go into surgery, it's fresh in my mind and I can go ahead and move forward on this case. So we saw, and here's the kind of that planned. So they're not the actual implants. This is just on the software that I use for case planning.
How long does it take you to plan a case, doctor?
That's a good question. So some cases take a little bit longer depending on the intensity, for example, of if I have to do a major graft, if I need to rebuild the ridge, that takes a little bit longer to plan. But in a case like this doesn't take me too long at all. Maybe 20 minutes, 30 minutes, something like that.
Okay.
So we saw the video of the placement. So here's the initial pilot drills. I'm kind of locating the position of the implant that I want it to end up for the final prosthetic or set of teeth. Here's the implants in place. These are healing abutments. So these are little caps that go into the implant, and then the tissue will heal around those. And then here we've got the actual case completed, implants in place. And you can see that the position of the implants is very similar to what I had planned out. So I think that's very important because I want that predictability. I want to be able to replicate. I want to know that when I deliver a case, when I finish and complete a case, that I can anticipate the success. This thing has to last him the rest of his life. So I need to build into it that sort of success. And that's why I'm so adamant about, like you see, he's got 6 implants on the upper, 6 on the lower. And you can see here that the very last implant supports the last tooth, and the mechanics of that just works out so much better than having 4 implants, and the back implants are extremely angled, and not having that most back or posterior implant to support the load of this bridge, because it's got to last him the rest of his life. So like for example, here's a case, just pulled it from the internet, but they're attempting an all-on-4 right here, but there's a mile of bone back here in this area. There's no reason that they should have placed implants back here. That's where the support and the load needs to be. Even in the upper jaw, there's plenty of bone here to place implants in that furthest back or most posterior area of the jaw. But because of the corporate all-on-4 centers, and because that's what's on this doctor most likely was just thinking, well, we're just going to do 4 implants because that's what I've been or sold the patient, right? But in reality, again, you've got to do what's best for the patient. 1, these are way too short. 2, the position needed to be more distributed. I would say even put in, what does it hurt to just put in 4 more implants? You're already in there, unless they didn't raise a flap. I don't know. But it's just kind of a classic, typical case where, the planning was kind of narrow focused, I guess. They're tunnel vision. If you just only think about, well, I'm only doing all on 4, so I'm only placing 4 implants, and not really designing and planning the case out and thinking, okay, what is the very best thing for this patient? And this, to me, looks like they could have easily placed longer and more implants to give the patient a better outcome. So, and then you can kind of go over, well, here would be an all-on-4 case, and this actually comes from the website of the guy who developed the all-on-4. So, the reason they angle these implants here so extremely is because they're trying to avoid the sinus. But it eventually there will be problems here. One, because they didn't look at the lower jaw and fixing the mechanics of the lower jaw. They're only trying to get, they're only doing implants on the upper. Whereas when I look at, and I design cases and I prepare cases, I want to look at the whole mouth, because that's what's going to ensure the success. Long-term success is that the mechanics of the whole mouth has been considered. And because if you can imagine here, Memo, the front teeth are going to put such a heavy load on this front area if they don't replace these back molars. And so, and maybe they did. I don't know. I just pulled this from the internet, but.
Well, sorry, doctor, but I have actually here in this newsletter that I was telling you about, there's an X-ray that I wanted you to look at, so you can kind of, because they did place 6 implants, and we pushed towards that,
right?
But they're calling it all on 4, and the 2 in the back are long and angled.
Oh, that's a zygomatic implant. So they're way in the back.
Yeah.
So that that's the zygomatic implants, and that's for patients who are severely atrophic, meaning the bone is atrophied a lot. So there's not a lot of bone there. So they put implants in the zygoma, which is a hard piece of bone, basically forms your cheekbone. And so those are, zygomatic implants. They work really well, and it avoids this sort of a situation where, you've got, they've attempted to put implants in, and there's no way that when they place these that they didn't know that this bone is way too soft. Like, there's just no way that this is going to work. I'm not sure exactly what happened here, but you can see that he's got implants everywhere and they've just fallen into the sinus. And so this is kind of the opposite extreme. They've tried to put in, 1, 2, 3, 4, 5, 6, 7, 8, 9 implants, all of which have failed and are up into the sinus at this point. So again, planning is key. You've got to plan these cases out properly. You got to know the patient. You got to know what you're dealing with. You got to know, we would have seen on the CAT scan that this bone is very soft. So immediately I would have been thinking ridge augmentation, bilateral sinus augmentation, like really build that bone up so it's strong, it can withstand and handle the load of, the bite force. So, and not run into this sort of a situation where, for one to have to go and dig these implants out or go find them would be a challenge, because that's, you got to go make a window in the sinus wall, find the implant, go in and recover it. So, so that's kind of the opposite side of things. So,
how long do you think it took for the implants to get there?
On this case here?
Yeah.
I think this is pretty immediate. I don't think it took long at all, because in fact, during the surgery, I just can't imagine what was going on here, or what what happened. I don't know. Because when I place an implant in the bone, I know, again, you saw the torque wrench, right? And so I know how much torque is on there. And if I'm not getting any torque at all, because if these just kind of fell into the sinus, there was no like resistance to the implant from the bone, so that the torque values were basically zero. That's the only way I could envision these actually falling up into the sinus cavity like this, that they just had no torque whatsoever. And or maybe, a lot of times I'll do a one stage where I'll do the bone graft and place the implant at the same time, but I won't do it if I know I can't get enough torque on the implant. I'll graft first, and then I'll come back and then place the implant. So I'm not exactly sure what happened here, but it's it's unfortunate.
We just know it was a mess.
Yeah, it's a mess. Yeah, for sure. All right, so let's see here.
I have this site, doctor, that I could share with you, and then we can kind of go over a few of the things that they're showing there. Let me see if I can.
What site is it?
It's just
AID.
I'm seeing if I can airdrop it to you.
Okay.
I don't know if you're getting it there. Yeah, there's some interesting stuff that it's a full-on, what do you call it?
Newsletter
that covers quite a bit of things, and like the all-on-4 modern concepts and techniques and the reviews that they have. If you scroll right there, you can see.
Yeah, so the AAID is the American Academy of Implant Dentistry, and yeah, I mean it's a great academy. They've been around for a long time, and as implant dentistry has become more and more mainstream. Back when I was a resident, I wouldn't even say it was mainstream. In fact, I've told this story before where, it was as a resident, and we would rotate through some of the other areas at Loma Linda University, and people thought we were wasting our time. They really did. In fact, Bob James, who started the program, he got quite a bit of, we're talking early 80s, way back when dental implants themselves were just a modality that was used in kind of not emergency, but very rare situations. It was not mainstream. There was no all-on-4. There was no, literally Loma Linda, they developed so many techniques, had a lot of successes and a lot of failures. But you have to learn through your failures. So by the time I got there, it was pretty established. And I was there in 1999. So 97 through 2001. So graduated in 1997, started August of 97 through August of 2001. So anyways, so by the time I got there, it was pretty well established. They weren't doing blades and blade implants or subperiosteal implants anymore. It was all root form implants, which is the screw. And so that was I never placed a blade or a sub as a resident. So only placed the root form or the screw implants. So, but yeah, the AIDs, they've been around since then.
So they're just an academy as well, like a school, pretty much.
Yeah, it's a. Let's see. It's the AID is it's more a group of doctors. I guess. Yeah.
Okay.
But it is all implant related, so it's pretty cool stuff. So, all right. Let's see here. Oh, I know what I was going to do. I was going to go. So we looked at Gil Smith's surgery and kind of looked at his case start to finish, the surgery part of it. Now let's look at let's see, where's his after photo? So there's his after photo. And, this is a transformative procedure. It changes his whole life. He's no longer having to deal with the dentures. He can eat, he can chew, he can just not worry about his teeth anymore, And and he'll be the first one to say it. Like, it totally just changed his whole life and made, improved it of course. We'll take a look at his, he gave us a nice testimonial, so I'll play that real quick. I don't know if you can hear the audio or not, but so here he is. Is there audio there? I'm not sure. No audio. Anyways, in a nutshell, he just talks about how, initially he was kind of nervous or afraid to talk with people because he was afraid his dentures are going to fall out, and then ultimately just kind of gave up on his teeth themselves, and you saw the video of the surgery and removing those teeth. So there was a lot of decay and stuff, but because he didn't know where to go or what to do or how to deal with it, So after he came here, we were able to put a good plan together so that, at the end of the day, once we finish with this case, he's good to go. I am very certain with good hygiene and maintenance, if he maintains this, and he has, this will last him the rest of his life. So
he looks so good from the pictures before till now, and even that video, there was no sound, but you could sense his confidence. You can feel it.
If we just compare these two photos here. Yeah, there's no comparison, really. And so...
Yeah, way different. And you know what, doctor? Because we see this here all the time. I was reading about frequencies. This is kind of... It ties to what we do here.
Right.
Because we understand that frequencies are a real thing, right? The radio, the sun radiates frequency. We even radiate frequencies. I mean, you have a spouse, right? You can tell sometimes when she's not saying anything, but she's sad. You can just sense that. Or when you're stressed, or even when you meet someone who's very happy, it's kind of contagious that you're like,
and
wow.
That's their frequency.
And that's their frequency. So they've done studies where they measure people's frequencies, right? And there's like a frequency chart, and when you're sad, you radiate less frequency. When you're very happy, when you're very confident, you're radiating different levels of hertz and frequencies.
Okay.
And we see that here. Like, we get people here with low frequencies, right? Because they're just not confident. They're not smiling, which is another thing that radiates frequency. And when they leave, it's just that frequency that they're radiating is just, it's showing. Like, it shows. You can sense it. People can see it from far away. We've shown, on our YouTube channel, we have plenty of testimonials,
right,
where just the person's just so excited, so happy about life and everything. And that's another thing, another reason why people should really invest in their smile and dental implants. Is just not only for your personal being, but for the people around you. Like,
that's
it's going to benefit your coworkers, your family members, because you're just radiating that frequency. And everyone has felt that when they meet someone who's just overly happy and excited, and they're like, sometimes it's like, why is he so happy? But it's kind of contagious,
Right.
Yeah.
I hadn't really thought about that, the frequency thing. But you can kind of see it in this picture. Like, he's a happy guy anyways, but the picture on the left-hand side of the screen, the before photo, of course he probably... And in fact, I think he had mentioned that he would take his teeth out just to joke around with the kids. They thought it was really funny. But if you look at that, if you look at the picture on the left, the before photo, versus the right, you can almost see that, like, his countenance, his confidence has shifted. To me, he looks so much more at ease and confident. Even though he's smiling in the picture on the left, the before, his after photo, his frequency seems so much more neutral and at ease. That's kind of how I see it,
Oh, yeah, and that's just one picture, right? And they say one photo tells so much. A video can tell way more, but if you see things live in real life, it's just. I'm sure if anyone were to meet him in real life, I don't know, they'd see a different person, someone who just lights up the world.
Yeah, definitely. So it has a tremendous effect and is a great, great thing to do. So, all right. So moving right along, and we'll see it like here on this. Here's just another case of before, and kind of the same thing. His countenance changes. His eyes are a little more bright. He's confidence is definitely improved. The issue of his self-consciousness about his smile is gone. Like it's no longer an issue. Whereas here, you can kind of even tell he's struggling to even show his teeth because he's so used to not showing his teeth. Like he has become so accustomed to have the musculature in his face, in his cheeks, his lips, his smile, to restrict his smile so that he does not show his teeth. And he's become subconsciously accustomed to doing that on a daily basis. So every time he interacts with somebody, whether it's at a grocery store, gas station, Starbucks, whatever it is, subconsciously he is trying to not show his teeth. It's a big part of his existence, persona, is because he doesn't want to be judged, right? He doesn't want to have people judge him because he has teeth that are missing. And a lot of times it's because they don't know where to go or what to do. They're not sure how to solve this problem. Even though there's plenty of advertisements out there, a lot of times they just don't really know how to move forward. So, but here you can see that, and this is new, so it was just put in his mouth, so he hasn't really, he still has he still kind of restricts his smile because that's what he's so accustomed or used to doing. And so, but as time goes on and he recognizes and realizes, wait, I don't have to do that anymore. Again, it kind of lifts him up a little bit so that he doesn't have to worry about kind of restricting his smile. So, and there's kind of a side profile view. And you can see now everything's restored. There's no gaps, no black spaces, no holes, and he's good to go. So this is the teeth or the prosthetic that was made. So these kind of slide into the tissue, and then the gum tissue will form around these zirconia. And so this is a titanium sleeve that goes down into the prosthetic. It's cemented in there, and then the screw holds that in place. I like to show this because it kind of shows the engineering and the design that goes into doing these sort of cases, and how precise this is. It's very precise. It feels very clean, very natural. Aesthetically, it looks beautiful. So, that's what allows somebody like this, or somebody that has that kind of that initial, their initial intention is they don't want to smile, to transition over to where they don't really worry about that anymore. So, and that's a huge weight that's lifted off their shoulders. So
that and being able to eat whatever they want now, because
that
right there is, just like we talked about right when the stream started, we got to take care of our health and not only exercise, but also what we eat. That's a big part in for the way that we digest, or even just if we have like a clouded mind or a clearer mind, for eating junk or bad things, it just affects your whole overall being, like your body and everything. And now these people can eat whatever they want, right? They can chew on whatever, they can actually follow a diet. 'Cause, I've met plenty of people that are missing teeth, and what's funny is that these people were kind of happy. I wouldn't want to say happy, but when the whole mask mandate was a thing, they were so excited to wear their mask. I know someone that still to this day is still wearing his mask.
Actually,
yeah, he lives in LA, and he's like, hey, it's LA, so he can still kind of wear it.
He can get away with it there. Huh?
He just doesn't want to show his teeth.
And is it because of his teeth?
Yeah, it is because of his teeth. Yeah,
that's interesting because we saw that so much here. Patients were so glad that the mask thing was going on, because it gave them an excuse to not have to. And it's kind of like what we're talking about here. Now their energy has shifted because they're not self-conscious about their teeth anymore. Whereas when they take the mask off, they have to go back to being self-conscious about their teeth and restricting their smile or how they talk so that they don't show their teeth, right? And so, and it's kind of like the frequencies and that energy that they're putting off, if they throw the mask on, then they don't worry about it anymore. So now their frequency, that like you were talking about, I just was thinking about this as you were talking about frequencies, that once they throw the mask on, now their frequency can change because they're not worrying about showing their teeth, Mm-hmm. Whereas if they were to just fix their teeth, then that's going to even elevate their frequency even more, because now they can really be free and not even worry. They don't have to worry about putting a mask on, or, they've truly restored an aspect of their life that is so critically important, and it affects them on a daily basis. It affects, whether they're awake or asleep, it subconsciously has an effect on them. So
well, it also flips, doctor, like 180 degrees, because like you're saying, their focus was on, I don't want to smile because they're going to see my teeth, and they're not going to say anything, but they're going to think about it. But now they have dental implants, they have almost a perfect smile, so it completely flips, because now what they're thinking is, I want to smile because they're going to compliment my smile, right? Like, right. Now that's their focus is, I want to go meet people, I want to go show my smile, because that really is one of the number one things.
I never even really thought about that. Now the shift is kind of the opposite end of the spectrum, right?
Yeah, I mean, remember Griffin?
Yeah.
And he was that's what he said. He just wanted to show people his smile. Because he said that the number one thing that he would get compliments on was his smile. Now, people would be like, wow, we have such nice teeth.
Yeah.
But all he needed to do was just smile. And so you go from a person who tries to avoid like social events or social encounters because they don't want to smile, they don't want to talk to someone because you're showing your teeth there, to someone who just 180 degrees wants to go out, wants to meet people, wants to get into sales jobs, just wants to show that off, because now the focus is, I'm going to get compliments, so I want to put my smile out there. So definitely.
It'd be pretty isolating. I would imagine it'd be really isolating to have this burden that they're carrying. I can't really relate. I can on a little, on a certain amount, because I do interact and deal and take care of the patients that have this. But unless you've actually lived through it and dealt with it and have teeth that are missing, or are completely self-conscious about anything in your body, whether it's your smile, whether it's whatever it is, it's kind of an isolating thing where you just, like kind of like you were saying, Memo, like you just don't even want to go out. You don't want to interact with people. And so you become super isolated. Whereas with, it can be restored, it can be fixed. It's just a matter of whether or not it's a priority for them, and if it's something that they want to take the time and the investment and the money as well to take care of it, Mm-hmm. But I know that, and I will tell my patients or patients that come in for a new consultation, if I could put this in your mouth for one day, you will come running back to me to have this work done, because it's going to transform everything. Like, kind of like what we're talking about here, just your frequency is going to change. You're going to feel more confident. You're going to feel, and all of these self-conscious ideas, or the self-consciousness that they have, will be gone, at least around their smile. I mean, none of us have everything perfect going on, but that's one thing we can solve, one thing that we can fix, and without any hesitation. So,
yeah, of course.
All right. I had a patient or consult last week, and they were talking about, well, I want to pull all of my teeth because I don't want to deal with flossing and brushing and all that stuff. And I'm just kind of going, okay, but of course I would never do that. And they were not a candidate to have all their teeth pulled. But in their mind, they had seen a lot of ads on television, and the all-on-4 centers that are the corporate centers that are marketing all over the place, all on four. She had seen these ads, so she thought, well, I'll just pull all my teeth out, put in 4 implants, and then I don't have to worry about it anymore. But actually, it is kind of the opposite of that. So let me just show this photo here. So here's a case where I'm just showing the underside of the bridge and then the buildup of the debris that builds up underneath there if it's not maintained. And so, and this next photo, I didn't place these implants, so don't judge me on that, and they're actually really old. So, but notice here, after years and years of neglect, the implants are all now exposed. So the bone has run down kind of the long axis of the implant, and now the threads are exposed, the hex or the top of the implant exposed. What should it look like? Let's see, I don't think I have. Not that. Here's the surgical video, but these are healing caps. So the crest of the implant is below the bone, so it's what we call subcrestal. And that will protect the implant from bacterial invasion down into to the bone. So once the bone becomes infected, if this stays on there for a long period of time, the calculus or the debris, eventually the tissue is going to get inflamed, and then that inflammation is going to work its way down into the bone, and eventually the bone's going to drop, and then that's how you end up with a situation like this, where now all the implants are exposed. At one point, I would assume these implants were at the bone level. I can't imagine that the doctor would have placed them to this point. But anyways, there was a lot of debris. I took the prosthetic out. I cleaned everything, cleaned the implants as much as I could, irrigate these out. And over here, this back implant, there's a lot of bone loss, almost to the apex or the tip of the implant. In fact, I thought I was going to remove it. That wasn't my objective on this day. I just wanted to take everything apart, clean it, and assess where we were at. And actually, this implant right here, which is the one that I did place because I restored the case and I placed this, that's where the position of the implant should be. It's right here. So we took it all apart, cleaned it up, and put him back together. But if we look at the underside of the prosthetic, there's just a lot of debris around each implant. Like he's not cleaning this. In fact, when I wish I would have taken a before picture before I took it out, because it was pretty messy. But it's just so the patient thinking that they're going to pull their teeth, get implants, and that'll kind of solve the issue of having to maintain it is not, that's not how it works. So once you get the implants, you have to maintain it. You got to, brush, floss, or irrigate, and maintain it just like you would your own natural teeth. So,
Doctor, we do have a question about
Yeah.
our prosthesis.
Uh-huh.
So if you can pull up a picture, because I think,
Yep.
that one that we were talking about. So here, they're wondering if the prosthetic gum is the same material as the teeth and if it lasts the same amount.
Wow, that's a good question. So, yes, it is the same material. This is porcelain, and then there's a layer of porcelain on the front side of the teeth. This area here is all zirconia. So this is, and the porcelain is more or less just kind of a layer on top, and it's baked onto the zirconia. So it actually is the same material. The pink is the same material as the porcelain layer on top of this bridge here. The base itself is all zirconia. So this is all zirconia that's been designed in CAD and ExoCAD, and then we mill it on the milling machine. We first will do this in plastic, make sure aesthetically it looks good, adjust the bite, whatever we need to do. And then we take that and rescan it. So we use like a 3D scanner. If I make any adjustments to this, in the patient's mouth, that's data, right? I need to take that data and get it back into the patient's file, because I've changed it a little bit. We're talking microns, but still, we want to transfer that data back into the computer, and then we mill the final prosthetic after I've made any adjustments to the plastic version. And you've probably heard us say the term PMMA, which is the plastic version of this. So, but yeah, no, that's a good question. This pink is a porcelain veneer, or basically porcelain layer on top of the zirconia. And it's a good bond. You won't see the change in color, the tissue change at all over the years. It's very solid and a very strong foundation. So, yeah, no, that's a good question, because you would think that, right? Like, and then we have some patients who say they just don't want any pink at all, and that requires implant positioning. One, case designing to be spot on, and two, the position of the implant. You can imagine, in this case, because we had to do so much grafting and kind of bone regeneration, my implants are way up here, right? So between the top of the implant, which would be, say, here, to the incisal edge of the tooth, that's a long distance. So you can imagine if that was all tooth, it would be a very long, the tooth would be very long. So, and that's why we need to give the illusion that these are actually the patient's real teeth. We need to use the pink porcelain on some cases. So there are some that we don't have to do that on. So, all right. So how do people get to situations like this? Where, and again, it's kind of just that kind of giving up. Or if you look at this X-ray, everything is kind of broken down. These are all just root tips in the bone that need to come out. And here's kind of looking at the inside the mouth. But these teeth are all just decayed, and everything needs to basically come out at this point. So, and how do they get to this point or this stage? It's hard to say. It's not, I don't want to even call it neglect, because it's not neglect. It's just, I think it's a little bit of a lack of understanding. And so, but the good news is it's certainly something that we can fix. But then patients will go and get work done and end up, having, whether it's the design of the bridge or whatever, and then having to redo it. And that was a situation here with this patient here. But also smoking played a huge role in this. And smoking is one of those things where, if you're going to continue to smoke, you have to understand that you're taking the risk on yourself. Like, we can't mitigate that risk at all. I can do perfect surgery and implant have high torque values when I'm placing it, grafts integrated, everything. But if you're going to smoke, you're putting that all at risk. You are literally, doesn't matter how good the person is that did the procedure, if you're going to smoke, you're putting it at risk. And just know that there's a chance that you may end up with complications or failure of the implant, which will ultimately you lose. Again, we go back to the frequencies. If you started like in this situation and ended up here and we're feeling good about everything and happy and your frequency shift occurred, but if you smoke, you could lose this, and then you're kind of back to square one. So that's something to really consider when doing these. If you need this sort of work. So
we have a question that's kind of interesting. Well, we actually have two. Let's cover one first. Is, can this be put in by sections instead of one piece for the upper? I think the full arch is what they mean.
Yeah. Well, I'd have to see an X-ray to answer that question. So the question is, can this be put in sections? Not really, because again, it's like building a house. If I design the house and I build it from scratch, laying the foundation, I know where all the outlets are for the electricity, where the lights are going. I've followed the plan to the T. I'm going to build a house that's exactly like I've planned. Whereas if I build the house one room at a time and I don't really follow a plan, or I'm just kind of going with, say, the weather, say it's, if it's raining, or if I live in Seattle and it rains, most of the time, but I get a day here and there where I can build my house, I end up with one room that's built, and then the continuity breaks up if I build it one section at a time. So, but there are cases where that can be done. It's just ideally you do it all at once, depending on what the patient situation is. Restore the aesthetics, the function, what we call the vertical dimension, which is the distance between the nose and the chin, the occlusion, how the teeth interdigitate and articulate. All of that needs to be designed and built into the design of the case. So in exocad, we design all of that, we build it into it. And if I do it section by section, I could maybe break the continuity or the flow and I'm a little bit restricted on the aesthetics. So I don't know if that makes sense, but it's ideally you would do the whole. In fact, you do the whole mouth, top and bottom, because some patients will come and they'll say, "I just want to do the top," and then later on do the bottom. And that too can work, but ideally we build it all together and we design it all together so that upper, lower, the bite, and articulation is spot on. So
when kind of adding to that, doctor, like what we talked about last live stream was the load distribution, how everything has to be, what did you call it again? I keep forgetting.
Just evenly distributed. The load factors have to be
because if you do, because you can measure it, and correct me if I'm wrong, but you can measure it when you're doing the full arch, especially like you're saying both upper and lower arch. You can really measure it, and you can really see how the bite is, it's opening and closing, and so that's how you can really determine what to do. And people don't realize how much force our bite has, right? And even when we're not chewing, you can have a bad dream and you're grinding your teeth, true. Right? You can just and if that's not evenly distributed, then it could affect the prosthesis, right? I could be wrong, but I don't know.
Definitely, absolutely, you're not wrong at all. You're right on the money. In fact, sometimes when we put the prosthetic in the mouth, because they haven't had it's almost like sleeping without a pillow, like you have nowhere to rest your head. And when we put the teeth in the mouth, now all of a sudden it's like they have a pillow again. They have a place that they can land their jaw. And so they may actually, some cases, they'll start to grind a little bit because they like that feeling. They like the feeling of having a place for their jaws to end up. So, and it takes a little bit of time for them to get comfortable and just know that, oh, this is just how it's supposed, the natural feeling of having a full complement of teeth that are perfectly articulated, meaning they're hitting at the same time on the right side and the left side. They haven't had that feeling for a long time. So sometimes we see that they'll kind of grind a little bit because they like to have the feeling of things being in balance, and so they just tend to clench down or grind sometimes. So we'll make a night guard and that sort of thing to make sure that doesn't happen. So
okay. And then one more question, I guess, going along with the prosthesis that we've been talking about. I'm just going to shorten it. Basically, are there any foods that can deteriorate or dissolve the prosthesis faster than others?
No. No food is going to break down the zirconia. There's not anything you could put in your mouth that would be toxic enough to the zirconia that would break it down. Now, if it was a hybrid, again, we've talked about this, but the hybrid is what you get from the corporate all-in-4 centers. It's a plastic set of teeth on a titanium framework. And those, yes, they can break down. The plastic is plastic, so it kind of adheres things a little bit more. It's porous. This is not porous at all. There's no porosity in the zirconia, whereas plastic is porous. I mean, it draws in fluids. So on a zirconia prosthetic, there's nothing that can break it down. So yeah. Well, let's see. I kind of wanted to talk about some of the things that we do, or I do, to kind of get ready for these longer surgeries. Like I said, we'll be in there in the OR for 6-7 hours, and it can be taxing. It can take its toll. And maybe we'll talk about this next week. But for all of us, well, no matter what you do, I mean, life can be stressful, and things are never perfect. But you've got to find those things that motivate you, that keep that drive, that fire inside of you going, so that you can navigate through the stresses of everyday life. And so whatever that thing is that you do, keep doing that thing. Don't stop. For me, it's mountain bikes, or my dirt bike, or timber sledding, or snow biking. Those are the things that, being with my family, those are the things that motivate me. And just being able to do them, and getting out, having clarity of thought, and just enjoying life. And life can be very stressful, but a good balance is really important. And with our diet, like Memo, like you were talking about, making sure your labs, your blood work is good, getting that good mental hygiene, oral hygiene, exercise, and doing everything we can to keep everything in order. So, anyways, hopefully today we got through some good cases, got some good information. It's a joy to do this. And if you have questions or comments, feel free to subscribe and like these videos so that we can continue to grow. And yeah, so I'm Dr. Willardsen here with Memo Hea. Thank you guys for watching, and we'll be back next week on Wednesday, 9 a.m. And I think we're getting better at this, so we're getting to where we get started a little bit closer to on time, and we'll get better and better as we go along. So we appreciate your patience with us, and we'll see you next week.